Hello everyone. We have a 40-year-old man who come to emergency department due to worsening right lower abdominal pain that radiate to the right groin area. And he had recently he was treated for furunculosis of the right thigh, and there is a history of type 1 diabetes. Fever is there, and there is a tenderness on deep palpation in the right lower quadrant without rebound or guarding. Extension of the right hip increases pain and flexion decreases the pain. If you look into lab report, TLC count is high, is in the upper side of normal. Best next step in the management is answer is CT scan of the abdomen and the pelvis. Why? Patient with recent history of skin infection who present with fever and abdominal pain relating to groin likely to have psoas abscess. It occurs from either hematological seeding from a distant infection or maybe direct extension of the intra-abdominal infection, diverticulitis, vertebral osteomyelitis. It can go directly. Risk factors include HIV, intravenous drug abuse, diabetes, like in our case, patient is a diabetic patient, Crohn's disease. They're all risk factors. And of course, this is the single most important. Psoas abscess frequently presents subacutely with fever and lower abdominal flank pain, although other non-specific features like weight loss, anorexia may be there, but typically subacutely with fever. Consequently, PA should be considered as a part of evaluation of fever of unknown origin also. Pyrexia of unknown origin or FUO. If you are getting, one of the possibilities that should be kept in the mind is psoas abscess. Now, deep abdominal palpation is required to elicit tenderness due to location of the psoas on the posterior abdominal wall. Psoas sign, abdominal pain with hip extension can be detected on examination. It's a very, very important sign. This is the way you are extending, and that can cause pain. Okay, so this is the place where the psoas abscess is there. You are extending the leg, and that is causing pain, increase the pain. But if you flex, it will reduce the pain. As a lab report, leukocytosis, thrombocytosis, like in our case, TLC count is high, is again on the upper side of normal. CT scan can require to confirm diagnosis, and drainage is critical because the pus, it has to be drained. Blood culture and abscess culture should be obtained to guide antibiotic therapy. That is for every case of pus. Look into this. So as pus we are getting in CT scan. Now let's look into other option. What about abdominal ultrasound? It has poor sensitivity. Why? Because it's lying deep inside, not superficial. So more gas is there, pelvic bones are there. So ultrasonography has less sensitivity for psoas abscess. Abdominal X-ray are helpful in determining bowel obstruction, free air in the abdomen, foreign body or renal calculi, and they have a low sensitivity for PA is not a useful indication. Colonoscopy, patient has clear-cut risk factor for psoas abscess formation, type 1 diabetes, recent furunculosis. So this patient with unexplained PA, colonoscopy may be helpful, but not in this case where we have clear-cut indication that psoas abscess is there. So colonoscopy has no role to play in this particular patient. Right hip joint aspiration. This is for hip septic arthritis. Fever, groin pains, pain typically worsen with flexion, but in our case it is worsening with extension. And moreover, in such cases when we examine, there are signs of inflammation, edema, warmth overlying the joint are there. So a quick recap of the last major revision point about psoas abscess. Summary, clinical presentation, subacute fever, abdominal flank pain radiating to groin. Anorexia, weight loss, abdominal pain with hip extension, SOAS sign. CT scan of the abdomen and pelvis, the diagnostic. Leukocytosis, elevated inflammatory marker are the sign that we see now. Any abscess, blood and abscess culture are needed for antibiotic therapy planning. Drainage, just for any abscess, broad spectrum antibiotic. Golden line to remember, SOAS abscess commonly present subacutely with fever, low abdominal pain or flank pain, radiating to groin. SOAS sign, abdominal pain with extension, and that in case with hip extension often is detected on examination. CT scan are required to confirm diagnosis, and drainage with antibiotic is the mainstay of therapy. Thank you very much.